Hey guys, it's Jocelyn again. Just another urge to preach to our choir, and actually I've been giving these questions a lot, from some friends. They think they got COVID and they don't know what to do, and I also do telemedicines, and I keep getting this question, so I thought I'll spend some time to record my thoughts, and perhaps you find this helpful. So these are the three questions I typically will ask if someone asks me if they have COVID-19. The first question is obviously exposure. So the actual cases that are confirmed are close family contacts, or friends that they were diagnosed, they have symptoms, and the patients later diagnosed have the same thing. Or road trips, longer road trips, long car ride, share car ride with someone else later confirmed COVID-19. There's actually a protesting case was later also confirmed COVID-19. I just saw so many people on the street. I suppose inevitable. So number two is if they have typical symptoms that's suggestive for COVID-19. I think everyone has those burning to brain cells. The news is just nonstop. But the cases I've heard and taken care of personally are the classic one, the muscle aches, fevers, overwhelming fatigue. Never feel like this before is what they say. And loss of sense of smell and taste, almost pathognomonic to me because I keep hearing this. Later confirmed diagnosed COVID-19. And at one occasion, diarrhea. So I suppose that does happens. Um, and lastly is if there's any other possible causes of the symptoms. Personally, I was coughing a little bit more than usual, and I got really worried. And it stopped, so it turned out to be the coffee that I choked on earlier. Another case when I was coughing more than usual, it was only at night, and in the morning it totally stopped. So I think I just left the window open, and the wind probably caused some reactive airway. So so try not to worry if you don't have to. Oh, there's another case of allergic rhinitis, postnasal drip that can cause chronic cough too. Those are not COVID. So the next question, I guess, is where can I get tested? Well, really anywhere you can. It's Wild West out there, especially when the suspected cases gets high, and just there's a line anywhere you go, except the emergency room, you will get tested for sure. So yeah, ideally you'll go to your primary care doctor. So when you're diagnosed, your doctor can take care of you, who knows you the best. Walk-in clinic, most of them has the COVID-19 test kits. All the urgent care does. The Minute Clinic offers free testing if you answer their questionnaire correctly with all the suspecting symptoms. And I think the reservations made online. There's other county and also local governments. They have all these facilities that's geared up for mass texting. And I think that Anaheim Convention Center is gonna have such a facility coming up soon. So if you know, let me know. Okay, I want to know. All right. So thank God you were diagnosed with mild COVID-19, as 80% of the people should. You're young, you have a strong immune system. The doctor diagnosed you and say you can just self-isolate, maybe give you a surgical mask or two for free, and then send you on home. If your doctor didn't spend the time to tell you what you should prepare at home, I have compiled a list. These are just my personal thoughts. So the first thing is a pulse oximeter, and this is told from the patient directly to me that this is the most helpful thing that she got. It's there's more than a few times when she feel the really bad, and but she measure her pulse ox and is 99%, and that reassures her, and it's just that reassuring number that does wonders to a person's mind. Other things like I suppose you want to measure your blood pressures and temperatures. So if you don't have those, it's nice to get. And otherwise, supported care, it's kind of it's not nothing if your pain has received relief from these over-the-counter medicines, then thank God for them. The Dayquil, NyQuil, Mucinex, they're all kind of the same thing. You can just choose one. They all have similar, if not the same ingredients. If you still have headache, despite of the Tylenol that's in them, you can add on a non-inflammatory and or what we call NSAIDs, either ibuprofen or Aleve for headaches. Some people has severe nasal congestions. Flonase is also over the counter, very low dose of steroids into the nose. Some people has this overwhelming dizziness. In this case, the meclizine is something that I suggest people to get. Some people have stomach upsets. I suppose COVID invades the GI tract. So Pepto-Bismol is something that I've been reading, and um, not a lot of people need to take them, but if you have the symptoms, maybe you can try, stomach upsets or nausea. Um, and lastly, it just all these throat candies, maybe some vitamins in them. And another thing is a lot of people feels a very poor appetite, after the sense of taste is lost. They also feel dehydrated. So I think Pedialyte also helps a lot, in addition to chicken soup, honey, green tea, other things, nutritious fluids. And then lastly is I prepare a separate talk for the potential supplements. Similar talks are online. All these vitamins and whatnot has some evidence for common colds, and some bench studies suggest they might suppress viral replications for the first SARS, not the current COVID. So no evidence if it will works for the COVID-19, but certainly suggestive, and some clinical studies ongoing for these supplements, and you can look up online or you can look at my talk. All right, so I suppose this is another thing that might be on someone else's mind if they are confirmed COVID-19 is, now they are sent home and they live with someone. What can I do to prevent the virus from spreading? So this everybody knows, but I can't stress this enough. Our president is wearing them. Everybody's wearing them. You should wear them, especially you're infected. And I should wear them even when I'm not infected, just because anybody can have it. So surgical mask at all times, face shields, and it's controversial, but I would imagine mask plus shield is still safer. And keep the window open. The airflow really helps, especially when the WHO changes their thoughts and thinks that airborne is a possibility. And there definitely has been case study series published suggest airborne transmissions, even though they are relatively rare. And these are more like common sense. We are kind of doing these already, but for someone who's infected with COVID-19, I suppose the best place to be is away from anybody else. So we're in the final stretch. I think out of all these suggestions, the most important thing is the first one is lots of prayers. Speaking as a Christian, I think there's only so much human can do. And I thank God, that one has strong immune systems and a relatively youthful age to have this mild COVID-19 infection, that the immune system will step up and make the antibiotics and take care of this. So just lots of grateful thoughts. I think is gonna do wonders for the psyche of a patient or really anyone to get through these tough times. And then, there's also some suggestions about keeping a journal. And it's nice to know how many days away from the true recovery. The one day behind you is another day for the body to make the antibodies to fight out the virus. And lastly, just a very healthy lifestyle of sleeping well. It's gonna enhance the T cells and natural killer cells to fight out the virus with good sleep, and then eating healthy, no processed food or anything that could cause further inflammation. Vegetables. Um, I suppose eating a blender diet and not so much meat is gonna be helpful. And then and try to not do something to exert yourself too much. It is a respiratory infection, so just the breathing takes some time to get back to normal, right? And also keep your doctor in the loop. If you have any new symptoms, you were sent home, but unfortunately, For the select fews, people do get worse at home and ended up needing to go back to the emergency room, or have some the new prescription the medications for supportive care to be prescribed to get you through this. Um, and remember the postdocs I was recommending, and so if you feel particularly bad, the first thing is just look in the mirror and see if you're short of breath, and by breathing fast, if you're using some neck muscles, if you cannot finish even a few full sentences or carry a conversation, well, it's probably time to go to the emergency room to get fully checked out and make sure you don't need hospitalization, because oxygen will save your life. And the hospital will do their very best to get you over this hump, and while your immune system build up the antibodies. So I was told that about 94 at home for a COVID-19 patient is pretty good, and I think it's good enough. So this is the end of my spiel. Thank you so much for listening. Again, comments is appreciated, and especially constructive criticisms. I would really appreciate those. So thank you very much and take care. Stay safe and God bless you.